Hello, and welcome to NYFA's Webinar Wednesdays, a weekly virtual series specifically designed for Nebraska communities and housing partners. Today we'll be discussing the topic of long-term emergency management. My name is Royce Scheibel, Data and Research Analyst at the at the Nebraska Investment Finance Authority. Due to the pandemic, NYFA is postponing its 2021 Annual Housing Innovation Marketplace Conference until March 28th through 30th of 2022. Instead, we'll be bringing you weekly webinars in 2021. Our moderator and speakers today are Chris Schroeder, Long-Term Recovery Specialist, Nebraska Emergency Management Agency, Dr. Denise Bulling, Senior Research Director, University of Nebraska Public Policy Center, Jason Feldhaus, Vice President, Connected Youth Initiative, Nebraska Children and Family Foundation, and Jeff Weaver, Executive Director, Sarpy County Long-Term Disaster Recovery Group. I'd like to thank Joe Spitzen of NYFA, who's behind the scenes helping to monitor the chat and answer questions. We'd like you to please save all questions until the end of the presentations. You can use the question feature on the right to input your questions, and NYFA staff will hold those until the end of the presentations. If you would prefer to ask your questions, simply press the raise your hand button and we can unmute you. Thank you again for attending, and I will pass it over to our moderator, Chris.
Thank you, sir. Good afternoon. Good morning, everybody. We're off to a great start. Good morning, ladies and gentlemen. My name is Chris Schroeder, and I serve as Long-Term Recovery Specialist with the Nebraska Emergency Management Agency, as well as Voluntary Agency Liaison for the state of Nebraska. I want to thank you all for taking some time out of your day to be here, and also give a massive thank you to NYFA for hosting us and making all this possible. I have asked a few friends of mine to join me today to have a conversation on the topic of long-term emergency management and disaster recovery, but we would love to hear from you as well, so please feel free to utilize the chat box feature and participate in the discussion. Your voice is important. We'll be touching on the flood of 2019, the ongoing global pandemic, what individuals, families, and communities around Nebraska have been dealing with these last couple of years, the highlights, lowlights, struggles, and successes, as well as how and why issues continue to surface even today, and where we are all going from here. So, long-term emergency management and disaster recovery, let's talk about it. And here, as Royce mentioned, to do exactly that are disaster behavioral health expert Dr. Denise Bulling, who is a trainer on the national level for federal disaster crisis counseling programs, and who also serves as Senior Research Director for the University of Nebraska Public Policy Center. Good morning, Dr. Bulling. Thank you for being here.
Morning, Chris.
Local leader and Sarpy County Disaster Recovery Group Executive Director, Mr. Jeffrey Weaver, who continues assisting families in his community and beyond, and who has helped provide donations and assistance in many forms to friends and neighbors in need, totaling in the millions of dollars. Good morning, sir.
Good morning, Chris. Thanks for having us.
And Mr. Jason Feldhaus, who serves as Vice President of Youth and Family Sustainability for the Nebraska Children and Families Foundation, and whose work emphasizes older youth, rural communities, those with experience in the foster care, juvenile justice, and homeless systems, and many, many, many things in between. Good morning, sir. Thank you for being here as well.
Good morning, Chris. Good to see you.
And one final thank you to all of you for your time here today. We are gathered here today almost 2 years exactly from the day of the start of the flood in 2019. Yesterday, the 9th of March, was the first report of localized flooding here in Nebraska, and the 21st of this month will mark the day it was declared a major disaster event by the president. So, in beginning a conversation around long-term recovery and emergency management, it feels only fitting to begin with the flood itself. Jeff, your long-term recovery group has evolved extensively since then, and I want to get into that. But if you would, take us back to that moment in time when the rivers rose and flooding swept the state and the region, and talk about how it all unfolded for you on the ground in Sarpy County, how a group of nonprofit and local partners came to be sitting around a table in the church basement, and what would ultimately become a conversation that would lead to the first meeting of your organization. What was the feeling in the room?
Thanks, Chris. You know, 2 years, to the month, basically almost to the day, as far as when the floods hit. I was thinking about and going over the notes in preparation for this. And, I wasn't a part of a long-term recovery group at the time. I was a minister at a small local church in Bellevue. At the time, I got a call after the floods hit. We made a call as a church to an organization, ended up providing, over $1 million with furniture, appliances, and mattresses to the local community, the flood impacted individuals. But on March 18, 2019 at 7 p.m., an individual, Colette Borland, started calling local churches, nonprofits, concerned citizens, and we met in the sanctuary at 7 p.m. on March 18th. 50 plus people, agencies, organizations, nonprofits, to begin trying to figure out how to respond to the situation. In Sarpy County, and I think in a lot of places, we were more reactionary rather than responding. We didn't have something in place at that time. And so out of that, this group of individuals who were committed to the cause of helping their neighbor and their community bonded together, stood in the gap, linked arms to each other, different faiths, different organizations, maybe in the same particular field, maybe would compete for certain things or certain projects or certain funds at one point in time at different times, all stood side by side because that's what the community needed. One of the things that was most impressive to me is the resiliency of the individuals who were impacted by the flood that are still, and I know you'll get into a little bit later as far as being hit again with COVID. The resiliency of the people was just heartwarming to us. But the thing that, as far as the long-term recovery group that grew out of that first meeting on March 18th to become that long-term recovery group, was a sense that as you walk through those doors, and every meeting and every nightly meeting after that, when we were meeting nightly to begin with, the thing that stood out to me the most was everybody walked in that door and left their ego outside. And I think that is something that I know you've heard, Chris, and we've heard over and over again for our little community here, is that there were no egos. It was working together. And I think that's a reflection of Nebraska as a whole, that every organization, every individual was there to help in any way possible, whatever they could, their neighbors, their friends, their community, and their small businesses. Sarpy County lost 399 homes. We had 1,001 impacted homes. 40% of those affected during the floods that we have had contact with, 40% of those have moved out of Sarpy County due to a lack of affordable housing. So the floods weren't just in March or in April. The impact is continue on, and the recovery will continue on for years to come.
Yes, absolutely. And we are certainly going to unpack that further. Jason, another group of people who have been on the front lines of these disasters these last 2 years and who serve their communities even beyond disaster events before, during, and after are central navigators, a term that some may be hearing for the first time right now. Can you help us understand what function central navigators serve for the Nebraska Children and Families Foundation, what role they play in their communities, and perhaps how that role has changed in light of Nebraska's most recent disasters?
Sure. Good morning, everyone. When we talk about central navigators from Nebraska Children and Families Foundation, what we're really looking at is an infrastructure that's built around collaboration amongst multiple and broad-based decision groups. So what we try to do is develop community collaboratives that have as large of a net as possible across the human services and human welfare systems. Looking at trying to find priorities for communities and then developing that infrastructure in a place that's most effective at the local level to make sure that people in need get resources in a timely manner. So it can be, most of the time it's behind the scenes working with other organizations. So like Jeff Weaver's organization, as they need additional supports and services for families, we're not passing families from one organization to the next so that they have a chance to access certain resources. The goal is to make sure that the families are where they're comfortable and working with the service provider or the organization that they're most comfortable with, but have an access to an array of financial assistance, additional case management, other resources that are available in the community. So central navigation in general is either an entry point for families in need, or it can be just an addition or an enhancement of where they've already entered at. So the goal is that it works amongst the community to make sure families don't have to repeat their stories. We stay very trauma informed on that. Families can go where they believe they're most well served, but then they're given full range and access to all their needs in general. And that comes back to the ability to have conversations, collaborate at a higher level. So Nebraska Children spends quite a bit of time investing in the idea of the infrastructure that supports those organizations to come to the table, and then provides additional resources for flexible funding, whether it's a braided system of both federal, state, and philanthropic dollars, so that organizations can reach further and farther with their individuals. We can break down some of those funding barriers, referral barriers, and just general knowledge. It's so difficult to understand. Even if you just take a community like Bellevue, all the resources in Bellevue and all the help. So to catalog that, Central Navigators give an opportunity to build that for other community partners. So that's in general how that works.
Chris, if I could add to what Jason said, I think it's imperative, and I know Jason mentioned it, but from the boots on the ground organization, without, organizations like NCFF and Jason, they didn't wait. They didn't sit back for months to, take action. They were proactive. They reached out. Without, those organizations, NCFF and others, those funders, those donors who were proactive and says, how can we help bridge the financial gap? How can we help you do what needs to be done? And the reality, without them, you can have the best of intentions, but unless you have those resources, both financial, those social networking thing that we can utilize to connect people, without that, we're just basically boots on the ground, but we're not as effective as we can be. And throughout that process, Jason, with the playbook and everything, lessons learned, how could we move forward, and without those organizations, those community members that, because the way we looked at it here at Sarpy, it wasn't just, hey, we're going to get you into a hotel. We were trying to look at how can we help you out of this situation. For a lot of the families, like in our county, they were economically challenged to begin with, so we wanted to see how can we use this as a catalyst to stop maybe some of the generational poverty, to educate, to prevent them being in a situation again the next time. So, but it goes back to those organizations such as Jason's and others who were, it was imperative to have those on board.
Absolutely. Another imperative organization and group of people is the Nebraska Strong Recovery Project. And Denise, you continue to play an integral role in facilitating that program and making it a reality. It is a free and confidential crisis counseling program operated through the state's 6 behavioral health regions, connecting with people in a litany of different ways. If you would, please talk about how these men and women go about helping individuals, families around the state, as well as the hurdles and obstacles that they need to overcome. To put it differently, this is a webinar series often involving and discussing issues around housing. And so why are we talking about mental health, and why is it important and relevant even in a forum such as this?
Thanks, Chris. Now, all of you know that disasters bring stress. And when you are under stress, it's really difficult to make good decisions. And we also know that disasters mean that you have to make a lot of decisions. Some of those decisions are about where you're going to live, what you're going to do, how you're going to recover. And in the flooding situation, there were people that had to make decisions about, do I stay or do I go? With where's my job? Where are my kids going to school? What am I going to do? And in particular with floods, flood insurance is one of those things that many people don't buy. So you think, well, your house insurance will cover things, and it doesn't. So flooding in particular is very stressful. the common thread through all disasters is that people experience loss. And when you experience loss, you grieve. And that loss can be something as simple as your, losing items. It can be losing safety. It can be losing jobs. It can be losing loved ones. So all of that impacts our stress and our mental health. Now, one thing that Jeff said is that people are really resilient, and that is absolutely true. Most people are going to be fine without anybody intervening at all, mentally fine, stress-wise. Some people need a little extra support to get them through the tough times, and a few people may actually go on to develop mental health issues that require some professional intervention. So the many, some, few principle is at work. What Nebraska Strong is not necessarily a therapy program. It's an outreach program to educate people about what the common reactions are to these very uncommon situations. So, for example, we know that if you are part of a disaster, you're a survivor of a disaster. And all of us are now with the pandemic, just so you know. As a survivor of disaster, you can expect to experience some things related to your emotions, kind of changing and intense emotions. You can expect that you may have, particularly in the short term, difficulty making decisions, trouble thinking, maybe a brain fog. You may have physical reactions like stomach aches, headaches. In particular, little kids may talk about their tummy hurting. It's, those stress reactions. And you can also have behavioral reactions. One of the behavioral reactions that shows up in young adults and kids is extreme risk taking. We see that with kids going to parties in the pandemic. We see kids who are impacted by the floods doing things like drinking too much and driving too fast. Behaviors often show up in the workplace or in school, school performance. And so all of those things are not necessarily signs that you have a mental illness. They're common reactions to this very uncommon situation, and there are things that we can do to cope. So what Nebraska Strong does is it has people in every area of the state, and in particular in those flooding areas as well. They've had them for over a year in the flood areas. And their job is to educate the public about those common reactions, to connect people with resources like the resources that both Jeff and Jason represent, and also to connect people to behavioral health services if they need it. Right now, there are also additional services available through Nebraska Strong and through the state related to vouchers. And in particular, in the flood areas, there are vouchers available for anyone who really does need to talk to a professional about their mental health. So the Nebraska Strong project is outreach oriented. It is everywhere. Its job is to engage people, educate folks about those common reactions, and to provide some tools and coping skills for folks who need that little extra support to get through these very stressful times. Back to you, Chris.
Thank you, Denise. These crisis counselors, these men and women, especially during and after the flood and ever since, even today, have often found themselves speaking with disaster survivors day in and day out for days on end. And often these are people who have lost everything, had their whole world turned upside down. They may be in tears trying to make sense of it all. The kids are upset. They don't know where to go, who to turn to, or what to do next. And it can be difficult to not match that level of energy. How are these counselors able, how do you help them handle all this day in and day out without letting it register on an emotional level? How are they able to keep themselves doing what they do best without letting it get to them, or sort of burning themselves out by trying to do too much?
So that's a really interesting topic, because the same experience that our workforce has that are doing outreach, we know that folks that are on the front lines, like Jeff and Jason and all of their groups, all the responders also face a lot of that same type of intense emotion. So we tell our counselors, our crisis counselors, that one of the #1 things they have to do is really focus on self-care. And so that self-care aspect is something that, in particular, emergency responders tend to neglect, because they put their work first and they rush into the scene, and they really are have a helping mentality. And so we really try hard to focus on, making sure that we do things like take mindfulness minutes. You know, take a minute to just see where you're at, to feel the ground underneath your feet, to listen to the sounds around you, to take some deep breaths, and then let them out slowly, so that you kind of take a minute to kind of ground yourself, to kind of relax, and before you go forward. And we also ask people to do things like identify the 5 things that you can do when you are stressed, or when somebody tells you you look stressed. So it's not just you thinking you're stressed, but somebody else says, hey, you look tense and stressed. And then what are the top 5 things you can do? And at least 2 of those things should be with somebody else, something social, because we know that we are connected from bad things happening, are protected from bad things happening when we're connected to something bigger than ourselves, whether that's another person, whether that's a faith, or whether that's a group, or even being connected with information and resources protects us from bad things happening. So our workforce, we try to do stress management sessions in every team meeting, and the crisis counselors then also take that same information and pass it on to the people they're working with. So if they learn a really good technique for managing stress, or for taking those physical symptoms down a notch, then they share those with the folks that they work with as well. So it's kind of works both ways. Does that answer your question, Chris?
Absolutely. Jeff, please go ahead.
Yeah, and Nebraska Strong, I sound like I'm an ad man here, but, for the great things that NCF did, but now also for the great things that Nebraska Strong has done. When you think of a crisis counselor and, Nebraska Strong, I can't emphasize enough just the impact that they have had on our organization and on my life. Because from day one, when we say boots on the ground, they were going home to home. They were looking and researching and seeking out those families who were impacted and individuals impacted from the flood, providing that guidance, that shoulder to cry on, as if you will, as during these difficult times, to where, people were having to make decisions they've never had to make before. I share the story that from a group, Nebraska Strong got together, one of the community support groups that I was honored and privileged enough to go speak at, and ended up kind of going weekly or monthly with these individuals as they kind of went on this journey. But that first decision these families make, what do we throw in the car? What do we put in the car? We've got 15 minutes to get out of our home. We get to the top of the hill. I remember an elderly gentleman and his wife, they get to the top of the little hill out of their community. And the first decision that he said they had to make was, do we turn left or do we turn right? Because they had nowhere to go. They didn't know what to do. The impact that these families were suffering from the emotional side, beyond the physical loss, which was huge, but the emotional loss that continued to happen when we were giving out food and water bottles to these families when they were coming to the churches and stuff. And a family I was carrying this box to this woman's car, and she goes, be careful, there's only 5 pictures back there. That's all I could get out of my home, of my family. That drives it home. And that's one of the things that without Nebraska Strong, with their boots on the ground, they're coordinating with our agency and all the other agencies in the state, Region 6, of course, our agency here, they were exceptional. And without them, without their guidance, without their support, but without their empathy, we would be a lesser state. We would truly be a lesser state without them and all of our partners. So, again, I'm the ad man, I'm the hype guy for you two on the, for Jason and Denise, but truly it is a group of partners throughout this state that, you talk about self-care. Sometimes self-care is realizing you can lean on Nebraska Strong yourself and you don't have to have all the answers. And so when you're suffering that compassion fatigue, you can meet them at a donut place or talk to a friend and just vent.
100%. And those crisis counselors with Nebraska Strong have connected with in a number of different ways individuals around the state. At last look, it was more than 1 in every 7 Nebraskans. I think it's even more than that now.
Wow.
Since October. And that's just for COVID-19. That does not even take into account all the work that was done in response to the flood. Jeff, if I may, if you would, rather, can you take us perhaps half a step back and explain a bit about what a long-term recovery group is, and then also a bit on what your group, or what changed about your group in, around, and about your response to the flood compared then to your response to the pandemic?
Sure. A long-term recovery group is stood up, after a flood and hopefully rising out of a co-ed, a community organization active in disaster. LTRG, long-term recovery group, disaster recovery group. It is there to partner with our communities to provide that case management, those recovery services to those families and individuals that have been impacted by the flood. We seek out using organizations that we're connected with from Nebraska Strong, through FEMA, through anybody that's applied through FEMA. We work through at the MARC, the multiple agency resource centers, looking to connect with these families. We had 1,001 families, 1,001 households that were impacted here in Sarpy County. And, it's real easy, I think it is, maybe I'm wrong to say this, I think it's real easy to get just caught up with the numbers and say 1,001 households. And Chris, I know you've heard me say this 1,000 times, so I apologize, but it's not 1,001 clients. It's 1,001 stories. It's more than that. These are individuals, and they have to be treated with the respect and the dignity and the care and the empathy that each one deserves. So we stood up. It was a delayed response, because I think that, and that's one of the things that going forward, we want to really seize upon to make sure that the next time, because there will be a next time, unfortunately, whether it's a flood, tornado, or massive fire, that we want to be able to respond, because we have the organization in place, the people in place, the case managers in place to react day 0 rather than day 60 or day 90. The case managers that we've had and the volunteers has worked up before we were even a formalized LTRG, as we mentioned, those 50+ organizations and partners work together to try to serve the community the best they could. So we've got active full-time case managers that meet these families where they're at. We don't want to help them just survive. We want to help to lead them to thrive, to walk with them on their journey. We have families that have been afraid, or individuals afraid to go out of their house. And so a case manager actually gets her out and they go for a walk, just the two of them. Connecting with Zoom calls, connecting them with the mental health. We have families that are fearful when the rains came in 2020 and they were in a new place, but it was still down in a particular area where there's lots of flooding in Sarpy County. And this single mom with a 2-year-old kid kept all of her kids' toys and clothes in the big black garbage bags because she was fearful that she wouldn't have time to grab everything again. So we provide that case management to meet their needs. Housing, food, clothing, utility assistance, medical needs. We had a woman who couldn't get her wheelchair, so working with FEMA, different things like that. But beyond that, we provide those holistic wraparound services to maybe work with them on budgeting, work with them on some financial counseling so that they can be better prepared, because we don't want to set these families to get to a point and then crash back down. So the limited time that we've been blessed to engage with these families, if we can impact them in a positive way and set them up for continued success, that's our journey. That's our goal. Our little tagline is hope, providing hope through help and healing. And that's what we want to do, because we have a resilient community. but there are times in each of our lives, whether we like to admit it or not, and I hate to admit it, we all need help. And so when we got to that 1 year anniversary to where we were getting ready to celebrate and honor those first responders who helped these families, who went and saved cats, who went down into the flooded communities on their boats and videotaped the home. So people would come back and say, hey, there's my home. It's only under 8 feet of water. Mine's at 10. The community, when we asked them how they wanted to recognize that 1 year anniversary, they said they wanted it to be a celebration because, as Denise said, they're survivors, but they wanted to honor those first responders who did things that they didn't have to do, that they did things on their days off. So again, even in their hurt, even in their loss, they were still recognizing somebody else. And that's kind of like the message we've heard all along. Well, we're here to help provide you, say, some food. Well, I don't want to take too much food, Jeff, because there's others who may need it more. That's a story that's been repeated. And so right as we hit that 1 year anniversary in March, COVID hit. And so rather than having that anniversary and a time for healing, the re-traumatization occurred again. And I know that Denise has a slide to kind of illustrate that a little later. But, it was one of those things to where these families were just, and this is no pun intended, just getting their head above water, so to speak, financially, emotionally, spiritually, and sometimes physically. And then this hits. And so it's compounded as far as all of the emotions, and they've lost jobs due to the flood. A lot of their businesses that they worked with were destroyed. And now they've lost their job due to COVID because a lot of businesses shut down. And so it was that going through the grieving process, the trauma again. And, when the rains will start back up this spring, I guarantee you those families that were impacted by the floods of 2019 will be thinking about the rain that's coming this month, next month.
Yes. Unfortunately, that will be something that sticks with them for a long time, but all we can do is continue to be there and understand that they're so much more than just numbers on a list. These are families, individuals. Each one has a story. Each one has needs. Each one is a bit different. In that same vein, Jason, your work with Nebraska Children and Families involves connected youth communities, which is not an effort that's inherently disaster related, although right now it feels like there's very little that isn't. But if you would, please talk about what those are, and at the same time, if you can, Jeff touched on what it all has looked like for him and his staff in Sarpy County, but how perhaps has all of this looked or felt different in more rural areas of the state?
Sure. Listening to Jeff's story about you get to the end of the street and as a family, you got to decide whether you're going left or right, and just the overwhelmingness behind that decision. We find that families in general, many of our Nebraska families on a daily basis are without floods and without pandemic, close to that decision of left or right. And so what we focus on at Nebraska Children is trying to help families develop locally based strategies to address those needs of those families. And so we use what's called Bring Up Nebraska through the support of braided funding of federal, state, and philanthropic dollars, and work with local communities to find the strategies that are best for them to address their most vulnerable populations and develop ways to increase thriving communities. And with a partner like even on this webinar and a platform that NIFA has and has allowed us to come speak, what we've learned at Nebraska Children is that housing, disaster relief, recovery, all of those pieces are an extension of that prevention work we were already doing. What we weren't aware of was the magnitude in which this recovery, this cycle of disaster was going to become the norm of our work. And that is what has changed over the last 2 Marches. the March of 2019 brought the waters, and the March of 2020 brought the pandemic. And what we have found is that our best laid strategies from a local level perspective not only has to include our normal systems change to help families reach better potential, have stronger opportunities, open doorways that may or may not be available to them, but we also have to work on the infrastructure of our state to support people in time of need. And what I don't think I was prepared for in many cases. So in 2019, no one in the foundation was working on disaster relief. I worked with youth transition systems, so that's the Connected Youth Initiative, to help foster youth and juvenile justice youth as they transitioned out of our state systems, find better opportunities and some solid ground. What we realized when the flood came in and someone had to raise their hand, I don't even know if I raised my hand. I think I was tapped on top of the head to say, okay, someone's got to go learn disaster relief. And so that's how I jumped in, both feet. And what I realized is that our ongoing work is recovery and resilience, and that the work that Jeff is doing, or the work that Nebraska Strong is doing, Denise and their team, is as much prevention for the future as well as it is intervention for the now. And neither one of those two things can be separated anymore. They are a continuum and a holistic approach, and our strategies have to encompass those. And so our philanthropic communities in many ways changed because we all came to the table and started talking about what is the long-term intervention that philanthropic organizations and funders have in cooperation and coordination with federal and state resources. Because it's those three different levels that are needed across the board to help families find what they need to be strong, but it's through strong, resilient communities in which those families can find roots. And so as some of that washed away in 2019, and then the rest of us got isolated in 2020, we've really had to look at our strategies long-term around community development and building and systems change, not just into the future, but through an intervention prevention lens. It's no longer one or the other, it's a combination. It's a holistic approach to changing the way that Nebraskans interact with their communities and access resources. And the great work that my two fellow colleagues here are doing can't be understated. For them, that left or right at the end of the street requires that probably all three of these levels are being put in place in a way that makes it easier for those families to make that left or right decision. They have to have someone locally that they can go to help them walk through it. They have to have big entities that can come along in time of need to provide them that support and structure. And then there need to be entities that are looking at resilience as the new way of business, not just recovery or moments or disaster relief, but constant effort to build up structures and supports so that families can stay above water.
Absolutely. Absolutely. Could not agree more. It's almost hard to believe that we let the month of March back in here after the way it's acted the last couple of years, but here we are. But yes, if nothing else, and for what it's worth, whatever the future may bring in way of disasters, we thankfully are more prepared, more interconnected than we've ever been. There's always room for improvement, but at the very least, we are not by any means starting from scratch, but from a place of experience. To that end, or I guess with that in mind, Denise, your work has taken you from colleges and universities here in Nebraska with the State Department of Corrections to even Puerto Rico following Hurricane Maria, and many places, many levels in between. And you have seen firsthand that there are commonalities and common phases in disasters, and not only the disasters, but then the recovery process goes through. And yeah, I know that you've got a slide that shows this very efficiently and succinctly, and I'd love for you to bring that up and just touch on what some of these phases are, what they look like or feel like, and then perhaps how they evolve or become different when a community such as ours is beset upon by multiple disasters at one time.
Okay, do you see the screen? Okay,
Yes.
good. So I'm going to describe this a little bit. What we know from research on disasters over time, and this can be hurricanes, floods, tornadoes, any kind of disaster, is that the community is in recovery goes through different phases. And I want to start by saying that the difference between an emergency and a disaster is that an emergency, for example, if my house burned down, that's a disaster to me. But it's not a disaster to the community because the community has resources they can pull on to put the fire out, to house me later, to deal with my needs. And the resources are not overwhelmed. Now, a disaster, on the other hand, is characterized by its ability to overwhelm local resources. And so it's not business as usual, because if you have 50 houses burned down, like the wildfires, that's a different animal. It overwhelms fire departments, it overwhelms response capabilities. It also overwhelms our recovery capabilities. So when I'm talking about a disaster and the collective reactions, I'm talking about when you have a whole bunch of people in your community who have these common reactions to disaster, and they are navigating recovery together with the well-meaning agencies like Jeff and Jason have represented, and Chris as well through emergency management. We know that there are phases the community goes through. So we start off by determining, was this a disaster with any warning? Sometimes you get warning and sometimes you don't. That decision to move left or right, there's a little bit of warning, enough to get out, and sometimes you have no warning at all. So that impacts whether or not, how you see that disaster, whether you see the disaster as human caused or an act of God or Mother Nature. It also impacts how you see it. But when it hits, what we see is a flurry of activity. And so, think back to the floods when you had, and we already talked about it, Jeff, the responders who rush in, who continue to go back and respond, who move towards danger as opposed to away from it. And in COVID, it's the same thing. We see healthcare workers going to work every day despite the danger. It's really heroic activities that happen. And our emotional highs and lows really vary according to these phases. So while you have the energy and adrenaline of response and that heroic activity, people are feeling, gosh, so grateful. And you'll hear things like right afterwards, you hear people say, we got out with our lives, we can rebuild. The rest of this stuff is just stuff. We have our health, so we're okay. Go check on my neighbor. That's what we call the honeymoon. And the honeymoon is characterized by the community coming together, neighbor helping neighbor, everybody supporting each other. And during that time, we start taking inventory of what we've lost. What have we lost? Have we been hit on the head by the disaster and we lost stuff? Have we lost loved ones? Have we lost a job? And we start taking that inventory. And at the same time as we're taking that inventory, in most disasters, you also see a group of agencies swooping in to help. And that bureaucracy, whether it's insurance or emergency management or well-meaning, helpful organizations, that comes with red tape. And when you're doing recovery, particularly if you've lost a house or a rental property or the place you live, there's a lot of red tape that goes into seeing if you A, qualify, and B, if you don't qualify, what are you going to do? So there's lots of forms and things you fill out. We call this the second disaster. And what this does is it starts as you start realizing what you've lost, as you start figuring out what you have to do in order to recover. It is a time when we call a phase that we call disillusionment. which essentially means that you're starting to realize what's gone. You're starting to realize how much time and energy this is going to take. And as time goes on, you have anger, exhaustion, fatigue, you're questioning, you have to make decisions. All of that leads to this collective period of disillusionment. As people work through their grief, as Jeff had mentioned, there are trigger events. The first time it rains after you've been flooded, the first holiday after you've lost someone. Those triggers come, they keep coming. And then you get to the anniversary where you start taking a stock of how far you've come or how far you have yet to go. And all of that eventually moves the community towards a new normal, a new beginning, reconstruction, but it's not an overnight process. And what we know during that disillusionment period is the people in charge, the people making community decisions, your leaders, there's intense pressure and scrutiny on them as well. So there's from disaster after disaster, one of the things we see is that our community leaders often step down, don't run for re-election. They are stressed beyond belief. They have to take stock of whether it's worth it because all the anger's directed towards them. And you can probably feel that now in this current disaster. So Jeff had mentioned that as you are moving forward with the recovery in the flood, then what happened is that we ended up going through these phases in those areas, and then boom, COVID hits. And so then we have a different set that we're starting over again. And then boom, something else, it hits again, because it's not just COVID and the pandemic is not just one slick event. It is event after event after event. And the anniversary, we're struggling with this. What is the anniversary? Is it the first death in Nebraska? Is it the first time that I knew somebody who was sick? Is it the time then when I had to go home and start working from home, or when my kids had to go to Zoom school? The anniversary is not as clear because really we are not done responding. We are not in the total recovery phase yet. There's still danger. And because there's still danger, we're seeing those collective, reactions going over and over and over again, and we probably won't move towards a more new normal until after the danger is gone. So with these collective phases of disaster, as we're going through this together, it's not unusual for our personal mental health to be impacted by the phase of disaster that we're in. And in particular, the helpers may have people lash out at them, and it's not about them. It's about the exhaustion, the fatigue, the anger about the slow recovery, whether it's related to flood or to the pandemic. So take a minute, and each of you think about where your community might be right now in these phases of disaster, and that may be a good way to start thinking about what might be coming next. Okay, so I think, Jeff, you're familiar with this, and that you've actually had some experience with this as well. And Jason, you probably have too. So I'd be interested in your perspective on where you think your communities are at right now.
I'll jump in. This chart right here kind of really explains the almost the new norm for philanthropic efforts and combined efforts with local and our federal and state resources. So I'm going to change the subject a little bit around just the individual impact of this, but go into kind of the management of this process. So we just received in early December, mid-December, we signed a stimulus package at a federal level that provided a sum of dollars, $2 million to the state of Nebraska for rental assistance. And as our federal delegates and our federal government comes to the realization that America in many places needs additional supports and services to recover from the pandemic, what we've also learned at a local level and a state level is that we're unprepared for these types of relief packages to come to the states. We don't have mechanisms in place in many cases. They weren't pre-developed to distribute this types of resources. How do you define and decide on equity and make sure that those most in need have access to these types of resources? How do you create situations of long-term sustainability and build off these types of investments in our communities as a recovery process? And so what we've learned through this is that it's a holistic approach from both the development of affordable housing and safe and stable housing, prevention efforts so that families are not in our state systems, that they have what they need to parent at home, partnerships with our local schools and our local communities. You talked about our local political structures and the stress that they feel. How do we relieve some of that stress from effective, evidence-based interventions so that we are getting the best results for families in Nebraska? And these last two disasters have really highlighted, for me, the efforts we need at a level of entry for these types of resources. How do we make systems change in which equality is the space in which we're working in? Make sure that our most vulnerable populations get to the front of the line in time to receive the intervention in a way that's most beneficial for them. And also, how do we do it in a way that's responsible, honorable, respectable, and follows all compliance? And so when you put up that chart, from my seat, from my perspective, the complication is the knowledge and the information you have to work across those different resources and the different types of interventions that come from a federal and state level are extremely complicated at the local level. Jeff does a great job of laying out some of the feeling of the families that they're experiencing and the workers are experiencing, and then add on all the complications in which those resources that are entering are there to help. But if we don't enter them correctly, we actually do more harm to our families than we do good. And so we are really learning quickly that as you put up that chart, that our business really is, like I said, prevention has become resilience. It's as much about recovery as it is preparation for the next phase. And it's one simultaneous effort. So as we continue to hit these different disaster phases, it's just the ongoing work to order our ability to be most effective no matter what that disaster is. And so from my perspective, when you show that chart, that's how we're trying to manage those different peaks and valleys. It's the ordering and ability to coordinate across all disasters as a simultaneous disaster in and of itself.
Right, and I echo what Jason says completely. On an individual, for some of our clients, that chart's a lifetime to them. That's over and over. This isn't something that's necessarily has to be a natural disaster, a flood, fire, pandemic. It can be their life because they're making choices daily. Do I feed my family or do I pay my rent? So where they're at, they get to the point, they're doing well, they think. They're at that point, they're in the honeymoon phase, we've gotten through this tough time, and boom, the job says, hey, we're gonna have to cut back your hours because you're full-time and we don't wanna have to pay you full-time benefits, so now you're at 30 hours. And so they go into that disillusionment phase and all of that stuff, they're taking that inventory all along. And this is a pattern that it's circular in nature, it's perpetual. And that's the key, is what Jason mentioned, is we need to break that cycle. I think, we were unprepared with all of these federal funds that came down, like Jason said, and what's the mechanisms to get those funds to the people who most need it in an equitable way. But I think part of what we ran into, and Jason, please correct me if I'm wrong, I think what we ran into is our organizations, our partners who received these funds, and we're trying to distribute them as quickly as possible. And they did an exceptional job of that, but their bandwidth is limited. As a result of that, Nebraska, and I think this could probably be echoed across our country and our states have been great at putting out the fire. But what Jason talked about and what is so critical at this stage, and it has to be parallel and happen concurrently, is that we need to be working on preventing the next fire. And I don't mean the next natural disaster. I mean providing the education, the knowledge, the system and the network tools and resources for our families and our individuals, the citizens of our state, so that when the next disaster hits, they maybe have a little bit of an emergency fund. And when it comes to that time to make that decision making, they know they can make it being an informed decision rather than a reactionary decision. So Jason, if I've spoken out of turn, please correct me. You have much greater knowledge than I do.
No, I think one thing you kind of allow me to spiral out from there, Jeff, is that we also have to understand in the state of Nebraska the vast difference between community and community. We have 77,000 plus square miles, but regionally, locally, from county to county, there's just such a vast difference. And so the ability to really hone in on what the strengths of each community is, and also where we can provide additional resources and supports and services is so valuable for the future. And so when we get a platform like NIFA and we get the opportunity to talk through some of this, the development of affordable housing in many of our communities allows for our workforce to increase. That workforce then allows more opportunity for even our nonprofits to attract individuals to their communities. So many of our communities, and Jeff mentioned it, the bandwidth is that we could provide more supports and services to Nebraskans, especially in times of disaster and need, but we don't have even the men and women available to be there to provide that assistance. And so our caseloads get bigger and bigger and bigger on the individuals that we currently have. And so we're even looking long-term about once you develop a strong workforce, like many of our long-term recovery groups who have done amazing work supporting Nebraskans, how do we help them stay in a position, if they're willing and wanting to be in a position to continue to provide sometimes the supports to Nebraskans, even if it doesn't mean it's long-term recovery group at that point in time, but what type of human services supports can they provide, and what does that long-term structure look like? So when the floodwaters do rise back up, they're right back in position to be long-term recovery groups. But in the meantime, there's plenty of support and services that we can provide to Nebraskans. And so these are all questions and conversations that we didn't have 2 years ago, and they were unnecessary. We were looking at other types of infrastructure and supports. But now we've realized, like Jeff said, our bandwidth, even with the availability of the resources, is not large enough to release those resources into a place of proaction.
Jason, I think you've raised a valuable point. And one of the things I've seen over the last 20, 30 years is that states and territories and tribes, they learn all these lessons, and then they go through a period where there is no disaster, and they lose the lessons because the people change positions, they change, who's in charge changes, and they have to start over again. So I've seen state after state go through a disaster, learn valuable lessons like this, and then they're unable to capitalize on those. They don't codify them in any way so that they're not passed on to the next group that has to deal with the same thing later. And it's vitally important that entities like Children and Families Foundation, NIFA, emergency management, even the nonprofit and community agencies, that those sectors help remind government that we've been through this, and that they have systems in place that are practiced utilized, exercised for small disasters so that when something really large happens, they're also ready to go. And we know that in the mental health world as well, that if you don't have a system set up ahead of time, that the characteristic of disasters is that local resources are overwhelmed. And when you try to create something out of thin air without having understandings, workforce ready, and systems ready to go, you scramble, and you may not be as effective as you would be if you had a playbook, so to speak, and people ready, willing, able to make that playbook happen. And that sense of control that you have going into those kinds of disasters will help your workforce maintain their own mental health, because they are not shooting from the hip, so to speak. They're not trying to make things up. They know that you have to be paying attention to those vulnerable populations, and that you have to move forward to activate those things that create and maintain resilience when the system is stressed. So very good points.
Yeah, Chris, and if I could just tag on to what Denise said, we're fortunate that, the organizations such as Jason's and NIFA and others aren't myopic in their vision of the circumstances that have occurred. They're looking that this is something that's going to be continuing to occur, and how do we respond and prepare. That's why it's so important that we have the Nebraska VOHAD, those volunteer organizations active in disaster, that are having those continual meetings throughout blue skies and gray skies, as well as Nebraska Preparedness Partnership, who create those liaisons and those partnerships from government agencies to private and public sectors to prepare, to educate during the blue skies when there's not a pandemic, when there's not a flood, so that we can be ready to go. So I think that, it's having all those partners at the table, having the dialogue, the conversation, that Jason's talking about to move forward, so that next time we're able to respond, not react.
Absolutely. I've just kind of been sitting here nodding, listening to you all. Every disaster is different, and there will be floods again in the future, but they may and probably will look differently or hit communities differently even than the 1-2 years ago. And there will always be those unknown unknowns, those things that we don't know about a particular disaster. And the last 2 years have been proof, if proof be needed, to that. The flood felt very intensely personal, and we heard stories from Jeff and so many others of people not only leaving their egos at the door, but I'm not sure what's going on or how I can help, but I'm going to go down to town hall or down to the church and see who's there and what they're talking about and see what we need to do. COVID has been the sort of foil of that, the opposite in many ways, and far from personal, but at the same time also very personal, and to the point of loved ones passing away and not being able to go to the funeral or say goodbye or whatever the case may be. And it's that phrase that you had on your slide, Denise, of working through grief, but sort of expanded 100-fold, and for it feels like time on end, but it's hopefully, and I think it is, working slowly up that upslope in the graph that you showed, and controlling what you can control and sort of taking one step at a time. And it's that easy and that difficult, granted, but reaching out to people and understanding that it's okay to ask for help, as difficult as that may be. To those points. Yeah, no, please go ahead.
I'm going to quickly put up on the screen how you can access Nebraska Strong Recovery Project resources. And even when that Nebraska Strong is no longer doing outreach, the Rural Response Hotline and the Nebraska Family Helpline will both continue to be active. And through the Rural Response Hotline, if you can't afford counseling and you want it or you need it, you'd like to talk about whether you need it, call the Rural Response Hotline, and they have vouchers that are available. In particular, they have vouchers available in the flood areas because we know that those areas have been hit with double whammies, and those vouchers will be in effect for some time. And anytime you need assistance, you can go on to the Nebraska Strong Recovery Project website as well and download information about common reactions and information that may help you. The website is in English and in Spanish. So I just wanted to share that so that if anybody is out here that's struggling or knows someone who's struggling, feel free to share the information and reach out to them.
Absolutely. And I know Joe Spitzen of NIFA put that link in the chat box as well. Jason, Denise used the word playbook, and I want to come to you and let you speak on that. The sort of running gag in the time of COVID-19 has been that we are writing the playbook as we go in dealing with all of this. But Nebraska Children and Families, the Central Navigators, a whole network of partners on this call and beyond have been doing exactly that and developed a series of literal playbooks to address and to handle, to expedite the road to recovery amidst COVID-19. And if you would, help us understand what those are, what those entail, perhaps where they came from, and how they have helped the recovery effort to this point.
Sure. So we'll go back 1 year in time to March 2020, and our schools started to close. Children started to come home. Families were encouraged to stay at home, and we started to self-isolate. And at that point in time, we knew that the efforts were going to be great to start working with the pandemic. I don't think anybody thought we would, you know, the efforts that we've gone through would be needed, but we knew this was new and unprecedented, right? And so the governor's office asked the Department of Education to start having conversations with communities to prepare for what they would need as far as resources and supports to support the local citizens and start to get out ahead of what was going to be needed to with the pandemic coming, or actually arriving. What we found was in partnership with the Department of Education, Nebraska Department of Education, Nebraska Children facilitated conversations across the state at a local level using Zoom, which in and of itself was a feat. We had to learn a whole new way of communicating and a whole new way of transforming information into action through a visual approach and an internet approach versus face-to-face, as well as we started to gather new types of data. And the data, this is not a technical term, this is a Jason term, but we started gathering data of anxiety and really just started to ask people, what do you think you'll need, rather than what do you need? And from those conversations, from those stories, from that dialogue, we were able to gather several interventions that could be used statewide and start to develop that infrastructure in which we would attach resources to, and then many strategies that were very local. And what that eventually rolled out into was a report to our state leadership around what those conversations developed and how they developed. We had community-based conversations, so I'm going to just list a few. We had many more than this, but Sarpy County was one of them, Douglas County, Norfolk, Grand Island, etc. So we had locally based conversations. We also had what we would consider expertise conversations, so around housing, older youth needs, seniors needs, those types of vulnerable population needs. And so we gathered data in a couple different approaches and then provided that to the state leadership so that when we received our first stimulus package, which was called the CARES funds, the state could look at something in which to start in applying those resources towards. And then those resources were applied at a local level to mostly local providers so that they could go directly into service for Nebraskans. So that in many ways was how we developed the playbooks. The playbooks are ongoing in that we continue to basically have what we call subcommittee or task force conversations. Chris, I mean, it needs to be noted on this too. You have done an amazing job leading the food insecurity work across the state. That's one of those task force. It's an ability for people to continuously have on their mind the needs and build strategies, infrastructure, increase access for things like food insecurity. We developed some housing task force across the state. Also, again, another one led by Chris, where we're really looking at not only current sustainability of housing and maintenance of housing, but then what's the long-term goal of Nebraska from a perspective of how do we increase availability of housing? How do we pull strings through our homeless services work to our rental assistance and mortgage assistance to how do we develop affordable housing and make sure that our families are in a position to afford what level of affordable housing we have in Nebraska. And so we've really been able to have these ongoing task force conversations and continue to really address both the today and of tomorrow. So the playbooks were originally designed to gather that local information, but now it's become a way to continue to have a dialogue about what resources are available, what needs we can address, and as well as strategize about what we believe the future can look like. I was asked one time, from my perspective, what has the pandemic done for our work? And I said this: there is not one single individual that has not been affected by the pandemic. And it gives us a new opportunity to build a different type of civility. And we've never had that before. Even the floods still only go through certain neighborhoods. And it does affect the whole community, but still there's a lot of people on dry ground. The pandemic did not leave that open to any of us. If you have children, they were out of school. If you have parents in long-term facilities, you know the stress that's been there. We've all had to work through the idea of where we stand on masks or no masks, or church or no church, or so forth and so on. But at some point in time, it's touched every one of us. And so it does give us an opportunity and to take these task force and look at where we are and what we want to be tomorrow. And so the dialogue includes all of us. And that, for one time, I think is the power of the pandemic and the opportunity of the pandemic, is that we're all now in the conversation of what do we want Nebraska to look like tomorrow.
I couldn't agree more, sir. Denise, we've had a great question come in regarding the mental health vouchers that you mentioned just a moment ago. The question is, to obtain those mental health vouchers that you mentioned, is it required that those individuals be citizens or legal residents? Can individuals with DACA or those with work visas access the vouchers as well?
Yes, you just need to call the Rural Response Hotline, say that you've been impacted by COVID or the floods and that you're interested in the vouchers. They'll take a little information, and the information that they take is to help match you with a provider and to ensure that the provider then gives us information that we can track back and ensure that you get the service that you need. So you do not have to be a citizen. You do not have to provide papers. You do not have to give them anything like a social security number or anything like that. So it is open, and you can access those vouchers without question.
That's fantastic. As Jason just said, nobody has been unaffected by the pandemic, doubly so for all those who were impacted in a number of different ways by the flood. And Jeff, yourself, your case managers, your entire long-term recovery group has been there alongside the individuals in your community and beyond, meeting them where they are and identifying those needs. And you have helped locate assistance in so many different forms, ranging from housing to food security to personal transportation and vehicles to legal issues and many, many, many other things. But for you, looking back over the last couple of years, what story stands out the most?
What story?
Mhm.
How do you pick one? Right? I picked the story of Nebraska. I picked the story of the individuals who have been impacted in floods to where, as was stated earlier, every disaster is different. Our community was hit by a flood. A lot of times with floods, people can rebuild. Our community wasn't able to, a lot of 400 homes couldn't rebuild in the areas that they were previously built. I think about this, there's so many stories, but it's the story of Nebraska. It's the story of us as individuals dealing with the loss, dealing with the grief, leaning on our neighbors, leaning on those NCFFs, leaning on NEMA and Chris, who came to our state in a time of need and has helped guide and lead us through his leadership and always being available during business hours and even after hours. Chris, I apologize about those things. But it's to me, it's the story of us. It's the story that what we're facing, we will get through it. Do I talk about the citizens that struggle every day, the people who aren't citizens, who the family of 7 who were hiding in a warehouse because they didn't want to ask for help from the flood because they were afraid what was going to happen to them? That still occurs today. People are worried how you heard the question earlier, can we get a voucher? Can somebody get a voucher if they're not a citizen? The reality is that we as individuals of the state have stood in the gap, stepped up for each other. I am humbled by the opportunity to be able to serve alongside my 3 colleagues here and hundreds of others of agencies and organizations. I'm the executive director, right? But we're not here because of me. We're here because of the 50 partners from the very beginning, from the chairs, from all those meetings, from the case managers and supervisors and the admin staff who do an exceptional job every day. I'm honored to serve alongside them and all of our partners. I'm from Oklahoma, but I'm not a Sooner. I'm also not a Nebraska Cornhusker fan, so don't hold that against me, but I'm proud to be a Nebraskan. And that's the story for me. It's the story of Nebraska standing in the gap, putting the egos aside and saying, what do you need? How can I help? Serving.
Very well said, sir. A final question for me, one in 2 parts, but for all 3 of you. I'd like to come to you first, Denise, and then Jason, and then Jeff. With the knowledge that we still have a long road ahead in recovering from the flood and now the pandemic, and with the possibility of additional disasters on the horizon ever presently, first, what message would you offer to the individuals and families still in need who are struggling and have been for some time? And then part 2, what would you say to those case managers, those crisis counselors, other nonprofits, other partners and stakeholders at the table who are working day in and day out to help them?
Well, I think the message for both groups is very similar, and that's take a moment to take care of you. That is going to make a difference in your own ability to problem solve. It's going to make a difference in your ability to work with others. So if you are feeling overwhelmed, whether that's because you have a long way to go in your recovery, or whether you're feeling overwhelmed because you have a lot of people depending on you, take a moment to take care of you. Do something that is healthy. And do something that is fun. We often neglect fun when we are in a position where we're faced day in and day out with stressors that are overwhelming. And it's okay to take time out. It's okay to take care of you. So that's the primary message. And if you see people around you struggling, take a moment and ask how they're doing and allow them the space to take care of themselves as well. So that's my advice for both groups, Chris.
That's tough to follow. Absolutely.
Ditto.
I would say this, for those that are in need, please continue to reach out, and we will continue to try to find ways to support and make sure you got what you need. Also, your voice is so important. How do we improve? Provide us with feedback. Where can we get better? Where can we be more efficient? There's nothing like what I would say customer response in some ways to help us be a better system of approach for those in need. For the state, I'm very optimistic. I really am. I see really cool things happening. This platform in and of itself is NIFA opening up doors to new conversations. NEMA and Chris sitting at the table and facilitating these conversations. This used to be strictly something that the philanthropic communities did. And now you're seeing new leadership in the state around opening up avenues where economic development and financing is at the same table with human services. And that is, I think, so promising for the future. I have nothing but hope that we can not only build bigger and better opportunities, but all can thrive. And I really see that from, it's not no longer just Department of Education and Department of Health and Human Services, but we have amazing partners at NIFA. We have amazing partners at NEMA. We have amazing partners at all types of state and local agencies and political entities. And we're all having really good common conversations around how do we help Nebraska be better. Last part, I think there was an article out there where Nebraska's number 6 for ranked in US News for states to live. I do see we can go up. I really do. And it's this kind of platform right here and these types of conversations that offer new opportunities where 2 years ago, we weren't sitting at the same table having these conversations.
As far as, I will echo both what Jason and Denise said. Continue, to give voice. You can hear somebody or you can listen to somebody. And we want to listen to the communities. Jason says he has hope. I agree. The vision that's coming, of what's possible, what we're seeing now is not just, futuristic hope. It's hope in action for today. All of those people that you serve, for everybody who's on this call, the people that you serve, let them know that you're there for them. That's the thing that we've stressed with, all of the individuals that have been impacted by the flood or COVID is that, people first, paperwork second, because we can get to the paperwork, but we want to care about you and connect as you as an individual, because your story is important. You're important. You're just as important as anybody else. And your needs are important. And so, our goal as we wind down the LTRG is from the flood stage, is that the last person that we serve gets the same quality of service as the first person. So we're going to continue to serve and our community, our Nebraska, our partners, and we're just grateful and humbled to be allowed to be a part of this this process and the future. And again, thank you, Chris and NIFA, for facilitating this conversation and this dialogue, and for all of those who have been on the conversation. I'm sure those listeners who are on the webinar who haven't spoken or shared, they have a ton of knowledge that we could all benefit from, because we all here stand on the shoulders of those who have come before us. So thank you all.
Absolutely. I could not agree more. Well said by all. And while our time here this morning is rapidly coming to a close, this need not be the end of the conversation on these issues, nor should it be. There are a lot of areas and there's a lot of tremendous work in long-term recovery from the flood with the pandemic that is happening every day, for which we could not do proper justice this morning, but in no way is it any less important. I asked our friends from NIFA if I could recognize all of our partners by name this morning, and they said no, simply because 12 days is too long for a webinar, and I understand. But if you'd like to find out more or get more involved, ask a question or anything else, please don't hesitate to reach out. My email is here, firstname.lastname@nebraska.gov. This is how I get around my issues with technology. My email inbox is always open. Dr. Bowling, Mr. Weaver, Mr. Feldhaus, I can't thank you enough, not only for your time here today, but for all you do for our fellow Nebraskans. And I'd like to say the same to all those here in attendance and our other partners, nonprofits, officials, representatives, long-term recovery groups, and stakeholders who are on this call or who may be watching this later or who even are not. Your work can be measured in a number of lives saved, the number of families preserved, the number of communities restored, and because of you all, those numbers are increasing daily. A humongous thank you again to NYFA for hosting us, making this possible, and everything that they do. And thank you all for being here, listening, and asking great questions. Please continue to be smart, be safe, continue to look out for one another, and take care of yourselves so that we can continue taking care of Nebraskans everywhere. Always remember that Nebraska is a much better place with you in it. Have a great day. Thank you again, Royce. Back to you.
Thank you so much, Chris. That was an absolutely fantastic session, everyone. I had several comments from the audience that this is one of the best sessions they've seen. So that completes our presentation for today. I want to thank everyone for attending. A special thank you to all of our presenters. And I would also like to take this time to thank our sponsor, JP Morgan Chase. This webinar has been approved for 1.5 hours of continuing legal education. If you forgot to enter your license number, you can contact us after the webinar at outreach@nifa.org. Today is the last day to register for our 2021 annual LIHTC compliance training to be held March 15th through 17th. You can register by going to the NYFA website. Remember, this webinar, along with all previous webinars, are recorded and available on our website, NYFA.org, under the Community Development Trainings and Webinars, or under our YouTube channel at NYFA Housing. Finally, one last plug for housing.ne.gov, a free website that lists and helps you find rental properties across the state of Nebraska. Thank you all for attending, and goodbye.